Hello, hello, hello. My name is Dr. Alexandre Sosa Frias. I'm radiologist. I'm the administrator of a website Virtual Radiology Clinic. You can find my post in the web www.dralexosarrat.com. And the proposal of this web is just to post and show some interesting cases and some diseases to better in the understanding of the diseases for a patient. And then because I think that if the patient understand better the diseases and the physiopathology of the diseases, then they can help in the treatment to know why you are not improve there is not improvement, why you are worse, and you can just take a measurement to do the best treatment and something like that. Also, I have this channel. And the proposal of the channel is just to explain better the diseases, and uh, I think that is better for patients. The day of today, I want to share the history of three brothers. This is just regarding the fatty liver disease. This is very important and dangerous problem regarding the deposit of fat in the liver. Then these three brothers go to or arrive to my hospital to check using the Winlet packets to know how is the health of the internal organ. Why? Because they are obese. Also, they have in the habit of eat a lot of KFC daily. They eat KFC. Then when I do the ultrasound, they have the age 16 years old, 15 years old, and 13 years old. The third of them, 16 years old, is the oldest. And as you can see here, this is a liver. You can see a dark image of the liver parenchyma and only available some portal veins wall and almost visible the posterior diaphragm. That means that this boy have a deposit of fat in the liver, and under ultrasound classification, he has grade 2-3 classification. Also available in the system, the lab test result, it has high triglyceride, and also the liver function is not good. That means that if we associate fatty liver with liver function altered, that means that this boy have metabolic disease, and actually this disease named metabolic disease associated to fatty liver, no alcoholic fatty liver. In this new classification, before only we mentioned in the old classification only fatty liver, degree, any degree. But now, actually, in the last investigation, they associate the fatty liver and they associate or not with the metabolic disease. With this new classification in metabolic disease associated or not with fatty liver, there are better explanation of the evolution of the fatty liver. Okay, the evolution means fatty liver keep keep inflammation and deposit of fat, evolution to fibrosis of the liver, keep the same behavior and the same problem with the liver, become more fibrotic until cirrhosis. Okay, just focus in the case of today. This boy have then metabolic disease, hepatic metabolic disease associated to fatty liver. This is the first boy, 16 years old. Okay, the second boy is 15 years old. This, as you can see, is the liver images from ultrasound. Using ultrasound is better. Is the visualization is better. You can see here the wall of the portal vein and better visualization of posterior diaphragm. Also in the lab test, there is not a dilation in the lab test. That means that this boy have fatty liver, grade 1, 2, because visualization there is available the wall of the portal vein. And because has not any alteration in the lab test, means that this boy only has fatty liver disease, not alcoholic. The third patient, remember, 16, 15, now 13 years old. As you can see in the ultrasound, the three babies, the three boys, sorry, remember, are obese and they have the habit to eat KFC every day. The third boy is 13 years old. You can see here in the liver parenchyma, full observation of the vessels. The portal vein is wall is available here in the small vessel. Also, the posterior diaphragm is visible. And in this image, I want to show the comparison between liver parenchyma and right kidney parenchyma. As you can see, the echogenicity is the same. That means for me, under my interpretation, this patient, even is obese, has not fatty liver disease based in this finding, okay? Because the assessment of fatty liver in based in ultrasound, only we focus in the comparison between liver and right kidney parenchyma, and also the visualization of the vessel and posterior diaphragm. But if you use maybe MRI, we can is best study to assess the fatty liver disease. Maybe under this using this machine, we can see in this patient any degree of deposit of fat. But in the day of today, with this ultrasound machine, we cannot see any deposit, okay? Even if the patient is obese, okay? Then this patient also the lab test is normal. Then for in the conclusion, I just say no fatty liver disease. There is not also metabolic disease in the patient in the lab finding. Eh? Then just to say that the machine that I use to do the ultrasound, only I can do just subjective assessment of the fatty liver. That means that I use the finding, my own finding, and based in that, I just do classification. But there are another machines, the ultrasound machine with the tools to the machine itself take the degree of fat in the liver based in percent with the comparison with the MRI studies. And if the patient have more than 5% of fat in the liver, that means that the patient have fatty liver. Then focusing or coming back to our cases of today, uh, is very important to know because I cannot generalize the finding of these three boys. Why? Because it's just very short sample. But I just will use these three boys just to give you my own opinion just regarding fatty liver disease. Okay, maybe in the future we can do one research regarding fatty liver and the deposit, the fatty liver, the degree, the evolution, and everything. Just if we focus in these three patients, we notice that they are they are sorry, brothers. That means that genetic have probably the same genetic. Okay, and also they have the habit to eat KFC every day, and they have different age. If you see the first boy, 16 years old, is more time eating with the same behavior, 15 years old and 13 years old. More deposit of fat with associate fatty liver function problem, little less deposit of fat, no fat detected in the ultrasound. Then, based in only distribution, we can just mention that probably there is association between the time eating or with wrong behavior and the deposit of fat. Okay. Again, this is only my interpretation, okay? But I want to share with you that wrong behavior or bad behavior, bad habit, health habit, means translate in problem in our body. Then just the recommendation and try please to change the habit. Use health habit, then you will be get better. The good news for this hepatic disease is that in the last research they demonstrate that if you decrease the weight, you lose weight at least 10%, the liver, even if you have fatty liver with a metabolic disease, fibrosis, or any degree of fibrosis, if you lose weight, then the liver will recover the parenchyma. Okay, and they recommend also because also fatty liver is associated to several diseases and several problems. For example, diabetes mellitus type 2, cardiovascular disease, cancer, a lot of joint the problem because the overweight, and a lot of diseases. Then if we lose weight, we will improve. The other recommendation from the last investigation is to practice sport. That not mean that go to practice football or baseball or basketball. Just they recommend only walk. If you walk every day, more than 7,000 steps, then after this amount of step, the brain and your body will leave some very good chemical substance that will help the body to clean, like imagine it like a clean your body from bad substance. Okay. Also recommendation, avoid stress. Okay, because the stress, when you are under stress, the body is prepared to any problem or something like that. Then you have your body is full of very bad substance, and because keep in alert, then it's very bad for the health and to keep stressed. And also the this exercise walking, not that does not mean that because I had one patient that this patient told me, no, I walk every day a lot because I'm manager of the building. Then I told him, no, no, this is not this kind of walking. Just you must walk, but as sport, okay? You decide to walk every day, for example, half hour, then when you are walking, you are looking around you, relaxing, checking everything, just forget you are just free of problem. Then this is the good thing. When you are just relaxing and you are just thinking nothing, and this is the good exercise, okay? Also, regarding the food, they recommend to use Mediterranean food. That means salad, seed, avoid meat. They said meat only red meat only one. If you like a lot, only one per week. Once per week. The chicken's okay, good. Fish better, and no alcohol. Decrease the alcohol. Just avoid this fast food. It's very dangerous, as you can see in these three patients that I bring today to show you. Mm. This is a recommendation for today, okay? Just if you want to see the full post with these three cases, I will leave the link in the here in the explanation, okay? Just thank you to allow me to go to your live. If you like this video, please like the video or dislike if you don't like. Just if you like the content of my channel, just register in this channel. I want to keep just sharing some diseases like this. If you have any recommendation, please just leave a comment in the video. Thank you so much. See you in the next video. Okay. I have a nice day, afternoon, evening. Okay. Bye bye.